Hello, my name is Sarah Bateup and I am the Chief Clinical Officer at Aliva and a scientific advisor to Clerkenwell Health, alongside providing mentorship to many other small digital mental health startups. I consider that I've had a very privileged career so far, in that I was arguably the first person to have access to thousands of verbatim therapy transcripts, alongside clinical outcomes for every session, therapist variables and patient variables, and I use this in my research to understand why some therapists are more effective than others. This is a driving force in my career and all my roles to date. I want to do something about stagnating recovery rates, the fact that there aren't enough therapists in the world and there aren't enough good quality therapists in the world. And most people seem to be trying to address this difficulty by using technology and reducing the amount of therapist time. I'm not convinced that this is the right way, and I'm looking at more creative ways of amplifying outcomes. In my role at Aliva Health, and Aliva is a B2B digital mental health company that provides high quality therapy and coaching to the employees of other companies in 26 languages. Myself and a number of scientists and the product team are working on using innovation in technology to amplify clinical outcomes, and to explore how do you enable therapists to be the very best they can be, and how do you enable patients to get the most out of therapy and maintain gains. These are some of the things that we're working on in our very small team. In my work as a scientific advisor at Clerkenwell Health, and Clerkenwell is a research organisation that is working alongside a number of other companies to investigate the effectiveness, the efficacy of psychedelic-assisted therapy in randomised control trials. Now, this is an incredibly innovative and creative industry in digital mental health and mental health as a whole. And Clerkenwell are partnering with another company called Empathic to use technology to understand what therapists are doing with participants in research trials, more importantly to explore safety and efficacy and fidelity to the therapy model that the therapist is supposed to be delivering. This is crucial in research trials because there is so much variance between therapists, and in order to understand whether something is working or not, you need to reduce variance as much as you possibly can. And also, we just don't know enough about what works for whom and why in therapy in general, and least of all in psychedelic assisted therapy. So this is incredibly creative work.